introduce yourself.
Okay, I'm Amina Razak. I'm the spouse of Mohd Anisur Rehman, who was diagnosed for rectum cancer back in 2012 in June, and then we went through a series of treatments, and later the last was surgery which we required. So we chose Dr. Sanjay Sharma in Bombay. We had previous good review about him, and we trusted that if we had come to him, I think we would he would actually be cured. So at that time it was me, it was him and my father, Mohammed Abdul Razak, who were both diagnosed for rectum cancer and colon cancer. So once when we came here, we were given all the trust that and assured that this would actually be cured. And initially we were thinking about it wouldn't be a permanent colostomy, because this is what I feared, and this is why I came all the way to Bombay for that, because I thought that if someone had this permanent colostomy, life would not be the same anymore. So everything went well. My father had his surgery first. He had a surgery for colon cancer, and then he's alhamdulillah cured. It's 7 years now, and he's well and well off from cancer. And the second surgery was 7 days after, was my husband's. And in the surgery day, it was a disaster. I should say my life actually I thought had changed, because Dr. Sanjay Sharma came out of the operation theater, and he said that he cannot save his from the permanent colostomy. He needs to do the permanent colostomy, otherwise there was a chance that this cancer would repeat again, because it was very narrowed down in his rectum, which actually, if he saved, would actually leave him a different life. So I had to fight within that surgery time, and he was such a comfort. He said that even if it was his brother, this is the decision he would given, and he said me to trust him, and I actually trusted him. And now it's 7 years, he's off this cancer, and he's living an excellent life. He does his regular irrigation, which also Dr. Sharma had introduced us to a nurse in Raheja, who actually taught us how to do this irrigation. And since then, he has never used a bag, apart from if he had loose motion. So his life has been very usual and very normal life. He has been doing everything. He has been riding a motorcycle, his own car, and doing his office and everything as usual. And today we've come here just because of a hernia, and otherwise it's fine, and his life is actually as normal as he was before.
So my small little inquiry for you and message for the people who are fearful for having a colostomy. Obviously, it's a little big decision.
Yes.
But would you advise for a normal life, if we have to remove the rectum, irrigation is a good alternative and it doesn't change your life?
Yes, that's actually I would advise.
So you are doing functionally, socially, everything, and even husband-wife relations, there is no change.
No, there is no change.
So you are as normal as you were before with rectum cancer.
Yes.
Right. So what do you advocate to, since you have an advocacy now in Bangladesh about irrigation, what do you want to advocate, advise our Indian people about that?
It's actually, we should go for permanent colostomy, because I've seen that I've met some patients that have not gone through permanent colostomy, and actually they're like suffering. They have leakage both the rectum side and the colostomy side, and they're not living a good life. I know a banker who has this, and he is actually not at all, he's not even eating outside, he doesn't go outside, he doesn't, he can't do even irrigation, so he's having this bag all the time, very uncomfortable life. So I think permanent colostomy is much better than this temporary colostomy they call, which actually doesn't change, you can't actually go for a normal life again. So it's more feasible and more better, I think. So,
बड़ा अच्छा heat
thanks to
है।
Dr. Sharma for having advised me for such a nice treatment. And I'm grateful to him and may God bless him.
Thank you. Thank you.